Hi, Mrs. Adams. How are you doing? Your granddaughter, she was with you last time. Couldn't come today?
Oh, no, she's sick and she couldn't come today.
I'm sorry to hear that. How have you been doing since you were discharged from the hospital?
Well, I get a little short of breath if I move too fast. And my ankles swell sometimes, but not enough to call you about.
Given those symptoms and your tests, I think it's time for a stronger medication. Tell me, do you remember the instructions that the nurses gave you at the hospital?
I remember everything the nurses taught me, and I'll do whatever you say.
Okay. Here's a new prescription. Take one of these each day in the morning. It'll make you urinate more frequently, but it shouldn't cause any troubles. And I'll see you again in a month.
Oh, doctor.
Yes?
Oh, nothing. I know how busy you are. I'll ask you next time.
Okay. This patient simply did not ask enough questions. Patients who don't understand their health problems and treatment can't care for themselves properly. Passive patients may later remember questions they forgot or were afraid to ask. Then they will have to call the doctor again. By not asking questions, patients may get confused about instructions, may not prepare for tests properly, or may take medications in the wrong way. Patients who don't ask about tests or treatment may have tests they are not sure they need, or may take medications they are not comfortable with. To avoid these problems, bring a small card or notebook of key questions. Write down your own questions before you go on the visit. To be sure your doctor makes time for your questions, say at the start of the visit, "Before I go today, I have some questions that I would like to discuss with you." Be sure to ask these key questions. 1. What is my main health problem? 2. What do I need to do? 3. Why is it important for me to do this? 4. What symptoms would be important for me to report before our next visit? 5. Do any of my medications need to change? Hello, Mrs. Adams. Hello, Jenny. It's good to see you both here today.
My grandma left her last visit a little bit confused. Would it be possible to take some time to answer a few questions?
Of course. I know these sessions can seem rushed, but there's so much information we have to exchange. Please.
Grandma, you have the little card. Go ahead and ask them.
Dr. Wolfson, what exactly is this problem you're treating me for?
It's called heart failure. I know that sounds scary, and it is serious, but we can control it with medications. What it means is that the heart muscle has been weakened by the 2 heart attacks that you've had. The heart is a little enlarged. It doesn't pump as efficiently as it has in the past, and therefore some fluid can back up into the lungs to cause breathlessness or into the legs to cause swelling.
What do I need to do to treat it?
Primarily take the medications as they're prescribed. I'll ask one of our nurses to sit down with you before you leave and help you generate a list of your medications and also make sure that you understand them all. And it would really be helpful if you would avoid salt in your food. Salt makes the body hold on to water, which means even more volume for the heart to be pumping around.
Why is it important for my grandma to do these things?
Well, we want her heart to function as efficiently as possible and to avoid getting any weaker. I guess the primary goal is to keep you out of the hospital.
I'm not sure always when to call you. What symptoms would be important to report back to you before our next visit?
You should promptly report any increase in breathlessness or leg swelling. You should also weigh yourself daily in the morning after you've gone to the bathroom but before you eat, and report to me if you gain 3 or more pounds from one day to the next.
Are you going to change any of my medicines? The last one cost so much, I'm not sure I can get the next prescription filled.
Oh, I'm really glad that you brought that up. What I can do is to prescribe a generic drug that will do the same things for you, but will cost less.
Oh, I'm glad I brought it up too. It's been worrying me.